So hi everyone, welcome. Thanks for joining us today. My name is Eric Lee. I am Assistant Clerkship Director at Maimonides Medical Center in Brooklyn. I am joined today by Drs. Shivani Modi, our APD, and Dr. Arlene Chung, our PD. Let me start this workshop off by taking you back to about a year ago in New York City. We had just been through a terrible first wave of COVID. The city was locked down and everyone was operating under strict social distancing guidelines. And that was the period of time that we were now tasked with preparing a new class of interns and welcoming them into our residency family. Now, that very beginning of residency, especially during intern orientation, is a period when traditionally our interns would rely on additional support systems and build these new relationships during their transition to residency. But now they had to do it during this time of COVID social distancing. And it's also traditionally a really important period of time for their professional identity formation. And this class was beginning that process during a time when the media was just constantly talking about the role of physicians and other healthcare workers during the pandemic. So in this workshop, we want to share with you guys what we've learned from our experiences in working with this group of learners during intern orientation from last year. And our learning objectives today are to share with you common themes and challenges that were experienced by junior learners during the pandemic, to discuss with you guys the importance of early programming, and also offer some strategies to help aid in their professional identity formation, as well as building community. And with that, I will hand it over to Dr. Modi.
Hi, everyone. So after talking with the residents, we identified two major themes that were areas of concerns for them coming into the program. The first was concerns about the quality and breadth of their medical training during COVID. Many of them worried that they had missed out on an entire year of clinical experiences and that they wouldn't have like the foundation to be starting emergency medicine. And they worried about where they were as compared to their peers. And so that was a big area of concern. And the second was their professional identity formation. So they voiced their frustrations about the politicization of medicine and uncertainty about the roles as physicians during the pandemic. Many of them felt like they couldn't really help out while they were off when they were in their fourth years as medical students, because they weren't working clinically, but they weren't quite ready to be in residency yet either. And so they felt like they weren't actually contributing to the field. And a lot of them felt a ton of pressure with the idea that they were supposed to be these healthcare heroes and frontline workers, where at the same time they were dealing with a lot of their own personal issues. And so that was a big area of concern for them. Minor themes also included their physical and mental health because they didn't necessarily have their support systems, such as their families or their friends, which they would have had going into residency. And then the grief related to COVID. So not only were their patients dying, but they also had an interesting end of their med school experience. They didn't really get to experience their graduations. They didn't get to celebrate this huge accomplishment that they had worked years for. So these were some of the minor things that came out, but I'm going to hand it back to Dr. Lee to talk about the education portion and how we address that major concern.
So one of the things that we did was we created a virtual community early on. During the post-match period, about 2 months before intern orientation, we invited the new interns to a Slack workspace to participate in an online virtual curriculum that was hosted entirely on Slack. It featured 8 to 10 bread and butter emergency medicine patient cases, and we would go through about 2 cases a week. And each case would have multimedia like x-rays, EKGs, labs that we could share through that online interactive platform. And we would post regular questions, answers, updates on each of the cases. And in doing so, we'd have conversations about them in the group chat. And all of our new interns participated in the Slack channel. And our facilitators included interested faculty like myself, as well as several senior residents and fellows. And this virtual curriculum actually had 2 major benefits. First, it was an opportunity to supplement the clinical education of a class that had their clinical experiences cut short, and to help ensure potentially a more equal footing before they all started residency. Second, it was a low stakes, low pressure environment for the new interns to safely meet one another, to regularly interact with us, with other faculty, as well as with their future co-residents in a virtual community. And I think that advantage, especially this past year, was a really major benefit of that curriculum. It's worth mentioning, this Slack curriculum is part of a larger multi-site educational study that we participated in. Our findings were recently published in Academic Emergency Medicine Education and Training, and the curriculum and the virtual community that we created with that has had similar success at other institutions as well. So I encourage you all to consider this option for your residencies going forward, or better yet, your institution can join the next iteration of this study. And finally, on the topic of virtual communities, I think it's worth mentioning that this Slack curriculum is, of course, not the only one that our new interns participated in prior to starting residency. We know that the new interns also have their own online group messaging chat set up among themselves and with their new co-residents that we're not a part of, even before they ever set foot on campus. And I think it's important to note that that is also a very important virtual community for them as well, especially in this era of COVID and all these different online kind of mixed curriculums that we do. And so with that, I'll hand it over to Dr. Chung.
Thanks, everyone. And so, clearly we're sharing some experiences that worked for our residency program. As Dr. Modi mentioned, one of the other major concerns that came out from this particular group of interns were concerns about professional identity formation, which is this idea that this whole prospect of becoming a physician is exactly that, becoming a physician. You don't just clock in, clock out of the job, but you absorb a lot of the attitudes and beliefs and values of a profession. And this whole process is called professional identity formation. And it's not complete in medical school. It continues onwards through residency and onwards through your career. And in the midst of the pandemic, there were certainly a lot of concerns about what it meant to be a doctor, and these were raised by our interns. So doctor as advocate, doctor as public health figure, doctor as healthcare hero, right? So all of these were concerns that were expressed by our residents. Now, the way in which professional identity formation is created, in a large part, it is actually formed through something called the hidden curriculum, which was described by Hafferty. And so there are three different kinds of curriculum. There's the formal, which are essentially classroom sessions, textbooks, the informal, which is bedside teaching, sort of semi-structured instruction, and then the hidden curriculum, which is essentially everything else, or the learning environment or culture. And so depending on the culture of an institution, you can either influence a positive, healthy identity formation or a negative and less healthy professional identity formation, particularly in these interns, right, who are just learning how to not just become doctors, but who are also learning how to become emergency physicians in particular. One way to promote a healthy sort of self-concept that embraces a range of emotions, doctors that are compassionate, doctors that understand that it is okay to ask for help, that it is okay to display a range of emotions, again, is through developing these social support networks, which, albeit are challenging during COVID, but some ways that we were able to bridge that include, things like a big sib, little sib program where the residents were, paired with another resident who was a little bit more senior. We have these mentorship families. We call them mentorship families, but they're really just social support families that we have within our program that consist of an attending, a 3, a 2, a 1. And so our residents get exposure not just to people within their class, but also others within the residency program and within the faculty. And certainly mentorship families are things that can be implemented in person or certainly virtual as well, right, with virtual meetings and virtual sessions. Lastly, something that we have tried to implement over the years has been a support network system where we inquire of all of our residents. We ask them to identify somebody outside of the residency program who is their main source of support during residency. So this can be a parent, it can be a roommate, it can be a sibling, it can be a best friend, anybody. And we actually, as residency leadership, reach out to each of them, to this other person and say, hey, My name is Dr. Chung. I work with your friend, son, daughter, roommate, best friend. If you have any questions about their training, or something seems off to you and you're not really sure how to address it with them, please feel free to reach out to me. Here's my cell phone number. And this idea is that it strengthens that support network where these people who help to support our residents, but we don't usually interface with much, have an opportunity then actually to come to residency leadership with any concerns that they may have, and the effect works vice versa as well. It's particularly helpful for people who did not grow up within a family or a household that was familiar with medicine, and so I think it really, I will tell you that the mothers all loved it, the moms all loved it, the people who that's who their support person was, but certainly I think it was helpful for everybody across the board. And through these things, again, they work both sort of pandemic, sort of within a pandemic and outside of a pandemic, by building up these social support networks where, again, hopefully we can create a healthy culture and a healthy learning environment around our residents that then fosters a positive, healthy professional identity formation.
Great. And I think I would have loved it if my residency program had that set up, because I would have loved to have Arlene or someone explain to my mom what residency was going to be like. I think, fortunately, in some ways, we are in a better place than we were a year ago. There is a safe and effective vaccine. Our residents and students are now at least can benefit from that additional layer of protection. And it appears that our residents may be able to safely gather together again as the COVID numbers go in the right direction. And all of these things should help to restore some sense of community again. But in some ways, we're also in a tougher spot than last year. This year's class will have even less clinical experience than the year prior. And we're still navigating uncharted waters with mixed virtual curriculums and responsible social activities, and figuring out how to support professional identity formation and community building under these circumstances. The specter of COVID remains, and perhaps forever will. So we'll continue to study its impact on medical education for many years to come. I believe that the lessons that we've learned this past year and the strategies that we've outlined will remain relevant and important for the foreseeable future. So, we thank you for your attention, and we're happy to answer any questions that you guys might have.
Additionally, I know people joined at various times. I did put a few links into the chat. If you want more information on some of the concepts that we were talking about and some of the ideas we were talking about, certainly 20 minutes is not enough time to get in depth with everything. But again, you're welcome to reach out to Dr. Lee. We are at the same institution, so it's probably your easiest point person, or certainly refer to any of the links that we've shared. And again, I'll send them out one more time.
I've got a question for you. So have you guys been able to notice any noticeable difference with your PGY 3 year that started pre-COVID as far as how close they are now compared to your PGY 1s?
Let's see. So I guess, are you referring specifically to like clinical level of like clinical experience, or like any other specific facet of that?
Yeah, I guess what I mean more is their clinical competency, their confidence, because they were able to experience residency before COVID, compared to the incoming class.
So I think that's a really interesting question, and one that I think a lot of people will be looking into. And I think it's tough because you want to compare apples to apples. So I think when our current interns are third years, there will be probably studies looking at that, because I don't think it would be totally equal to compare our current interns to our current third years. But I think that's definitely a question that's on everyone's minds. And I think we will probably get some more both qualitative and quantitative data to look at in like the near future.
I've got more of a comment than a question. Mark Berenson from Rutgers, New Jersey Med, so just across a couple rippers from you guys. We've certainly struggled with cohesion in the residency as a result of social distancing and not being able to get folks that were able to get together. So one of the things that we're implementing now is, and maybe a little ambitious, is quarterly class days off, so that everybody in a certain class has one day off where they're able to spend time together doing a joint activity, something to build a little bit more of that teamwork that we think got lost. I think it'll probably happen twice a year, because anything more than that, the schedule becomes a nightmare. But I think it's a nice intervention to aim at some of the things I think you guys discussed.
It sounds like actually a great intervention, because I remember, a lot of times we tell them like intern orientation, certainly in my residency, and in some ways with these guys, this is the last time you'll all get to be off together to go hang out or whatever until I guess the, class SAEM trip that we do later in residency. So I think that's a really interesting idea.
I think we're a few minutes shy of the 10-minute mark of the hour. I guess I'm used to saying top of the hour. If we can probably field one more question. Or if there are no more questions, Dr. Lee, you can maybe wrap it up and take us home.
Well, thank you everyone for joining us. This is definitely something that we're interested in, and I think everyone is going to continue to look at as well. So, we're happy to talk more offline. I think our contact info is in the chat, but thanks for joining us.